I guess another thing you have to be wary of is that sometimes institutions, they find people, if a doctor's office is, giving a patient something for them to talk to you, does that sort of discredit, I don't know, and that's another thing you sort of have to be wary of, whether or not these people are getting some sort of remuneration to talk to you. I guess just some tips on interacting with reporters. This is primarily for organizations, but prefer to quote the people who are actually making the decisions. And if you have any sort of ongoing need to deal with the media, just get to know the people that you're dealing with, get to know the reporters. Like examples and anecdotes, and feel free to call us when there are stories about us. And we'll probably call you multiple times to check if you check information. Excuse me. Just some ending thoughts on health reporting. There are too many good stories to write about enough time. We used to actually have a science reporter too that would cover some of the medical stuff. My time is divided between health and general features. And we run a lot of our stories, Associated Press, Washington Post, and the Collection News Service. So a lot of the stories you see will not be staff generated by the Richmond Times Dispatch staff. It will be from staff of the Washington Post or other wire services. And that's it. And I'll take any questions.
Can you talk about the insurance companies that are sending out these letters on that story, or is it all of the stuff on the website?
We'll see. And there are companies, they are sending out letters, and there's a group that thinks, well, if people know this is coming, the president did say, if you like it, you can keep it, but there are people who are saying insurance companies should have given people more notice. Like the lady that I had talked to about, I was going to include in the story, but didn't include, she had known since September that her plan wasn't going to be offered. And when the insurance companies are sending the letters are giving them an option. This is the plan that does meet your needs. The problem is sometimes it's more expensive. That's part of the Affordable Care Act that requires that all these plans meet essential benefits.
But they were sending out canceling letters every year.
Yeah, exactly.
And right now, it's being used as like it was the insurance company's way to jack up the prices, and they've been doing it every year. And now it's like, oh, wait a minute, it's the Affordable Care Act. We can do it even more. So it multiplied in numbers.
Yeah,
and it has political
there is a lot of politics. If you read some of the letters, they point out, the one guy ended up interviewing, he did send me the actual letter the insurance company sent to him. And it does say, because of new laws, so it doesn't exactly say Affordable Care Act, but it's saying new laws, which means the Affordable Care Act.
They don't refer, right? They don't say go there.
But the letter did, but the letters do offer them options. And I think that the issue is that people haven't been able to get onto healthcare.gov to shop, because in many cases, you're supposed to be able to find plans that are probably comparable to what you're paying now, but richer benefits. But I cannot say what's happening. Except HHS has 2 p.m. briefings every day with reporters to tell you what's happening. But I will tell you, in some of those briefings, so when the reporter asks a question, trying to dig deep, they kind of gloss over it. So it's like they're not giving the answer that you wanted, And I think I do. I'm not gonna say.
Oh, come on.
I don't know.
Come on.
I don't know. If I knew, if I had a crystal ball, it's like, why did it turn out so bad? It's like they knew. I mean, it's like, okay. you know your program is not going to be up and running October 1, like you said, why not hold it back? Because I do believe there was supposed to be the Spanish-speaking version of Healthcaregov, which they delayed rolling that out because there were some issues with it. Why didn't they do it with, all the time?
I just wonder if those people still have their job. I mean,
People are asking us.
I mean, who can, I understand about the weathermen, because that's hard to predict the weather, but they are getting better at it. But if that's your job to create that.
Well, but they told them it wasn't gonna work. The people that actually created it said it wasn't gonna work.
And the lead fellow resigned while you were gone.
But wasn't some people just waiting to see whether or not things were gonna not be there, no more Affordable Care Act, so they didn't do anything until the last second, and all of a sudden, okay, we got this website that's not big enough to accommodate all of these people.
I mean, what's the real story?
I don't know. I don't know. I wish I did know.
So how long have you been a reporter for Richmond Times-Dispatch?
I've been at the Times-Dispatch since 2000.
Okay, so got it.
I remember the first healthcare reform in the criminal report, and that died really quickly. That didn't go.
Listen, how does the Freedom of Information Act, how does the Freedom of Information Act work so that you can get to the bottom of this?
Anybody can file a Freedom of Information request with the federal government. The problem is how long are they going to take to get a response?
A long time.
And it's, yeah, I've
You can work in the government and file a Freedom of
Yeah.
Information Act.
they
And it'd be months before you get what you
yeah.
need.
It was
The
defunded
story
by
is
Trump.
over by the time you get what you
Exactly.
want. Well, thank you.
Tammie, Earth Matters as an organization, one of the purposes here is to get information out to folks and to support one another with people with chronic lung disease and things associated with that. You've heard some of the diagnoses that went around the table when people were being introduced. Some of them, like LAM and Alpha-1, there's very little known about those. So, I guess what I'm trying to ask is if we're trying to get information out about these lesser known illnesses, and sometimes like with the Alpha-1, it's a simple test to find out if you're predisposed. What do we do? I mean, do we contact you, someone else?
You can contact me, you can go online, list your meetings. I have a long list of stories I'm getting to, so I may not be able to get to it like as quickly as you want. A lot of people want stories like during a particular month because it's that diseases month.
It is COPD month this month.
We'll
Yeah.
see.
Same.
And if I tell you I can do a story, I may not be able to do a story, but I might be able to do a story 2 months from now because I have more time. So, just because you don't get it in that month, don't give up.
Is it good to like send you something written up
It's
already
always good
and
to
then
get.
you can massage it the way you want it?
Well, we can use it as a way to figure out what's the story here and who we need to talk to make it a story.
So if we've got an event coming up that promotes a rare disease, how long of a lead time do you need to be able to cover the story?
Are you trying to get it in a particular month or just a story in general? Or an event?
Well, the Lamb Foundation has just done an event, a fundraising event, and we're thinking of doing one next year. And I'm wondering, how much time will you need if I want you to cover that story? Do you need like 3 months, 6 months, 12 months?
I'd
And
say
can you
at least
cover
a
it?
couple of months before you actually have the event, just because as other things happen, if I have
Right.
to put the story off, I have time to
Right.
go back to it.
Okay.
So, at
Thank you.
least.
Have you heard much about the changes in oxygen providers and durable medical equipment
I
providers?
have, and I tell you, I pitched that story to it's more durable medical. I pitched the story to a business head months ago, because there was a local man who was one of these companies that bid on the contract or whatever. They
Health First?
Yeah.
Probably.
Sure.
Anyway, I couldn't get them interested. They don't really. I mean, and I interviewed the guy and I said, well, but if I have patients who are affected by that, takes it up a level.
Huge problem, huge
Are they
problem.
still being affected?
It's just a huge problem. My son uses a BiPAP machine, and trying to get a new one, his pulmonologist didn't even know who had the bid, Dan Grennan. Dr. Grennan spent 2 hours on the phone trying to track down. There's a doctor now, not his staff, a doctor who spent 2 hours on the phone trying to find out. He was unsuccessful. So some contacts that I had, I started working, finally found out, but it's people who have CPAP machine have one supplier. People who have a BiPAP machine have another supplier. People who have to have a ventilator have another supplier. It's just, it's a major, major problem.
Were you not able to call your insurance company and find out who they're paying?
See, my son has Medicare.
Does Medicare have a
No,
list?
Medicare. He has
Does Medicare
Medicare.
have to make a list available of who are the regional providers?
They do, but they don't separate it into individual equipment. See, when you talk about the CPAP and the BiPAP, the only difference between the two is that CPAP is forced oxygen when you inhale and exhale. The BiPAP does it only on the inhale, but they don't separate that. You wouldn't think it needed separating, actually. It's a nice.
And the person from Lincare, what do you have to say?
About what?
On the subject.
I have tons to say.
Okay, good.
As far as you go, I have a program at my company where if I had your son's Medicare number, I could pull up and find out, it's called a HCPCS code, basically which equipment is being billed and who they paid out to it. I'd be more than happy to help out if you're still having issues, and I can at least get you some information. Whether you go through my company or not, I'd still be glad to answer that question.
What's your name?
for you. Jimmy, I'll give you my company.
Okay. I talked to Chris up there.
Okay. I actually may know your situation.
Okay.
And you might want to get his card because he could give you some really good information.
Did you, as far as CPAPs and BiPAPs go, most companies should do both. Ventilators are way more medical. We don't do ventilators. I know 1 or 2 companies that do. It's not as prevalent as a CPAP or BiPAP.
And I'm trying to pick on y'all,
Right.
but y'all's 800 number specifically told us that they could not, that it was separated between BiPAP and CPAP. So I'm not trying to pick on Lincare here, but I think it's systematic with the whole industry that even if you call the 800 number, they don't understand what the rules are.
Right.
And I think that's not picking on them, because I don't think they're any different than anybody else out there as far as the lack of knowledge or the misinformation that's in the marketplace after the new July 1st rules went into effect.
A lot of the 800 numbers send you to India. I
Now,
was trying to get an oxygen equipment, put in my heat and air system, and every time,
Wait a minute, we're talking
Oh,
about
in India.
humans
Yeah.
versus
well, humans, but they were in India, they didn't know what would do what.
heating.
Finally, I chased down Honeywell, where they said, you've had so much providers, give it to you.
Well, I think a lot of problem too is that people are getting letters in the mail from their oxygen company saying we are no longer a provider, and they're not telling them who is a provider, because the other couple weeks ago at pulmonary rehab, when I was up there